I'd like to introduce myself firstly. My name is Peter Zoch. I'm coming from Germany, and I'm the Director for Marketing and Sales for Neopharm in Europe. We are working for Neopharm since about 2 years, and today we are here to introduce to you a new group of products. We call them OTC products for psoriasis. One word about Neopharm. Neopharm is a Korean company. They're based in Daejeon, 2 hours south from Seoul, Korea, and they are focusing very much on R&D. Basically, in the last 10-15 years, many new ingredients, many new products were particularly produced for dermatologist applications with a strong focus on atopic dermatitis and psoriasis. So, the new over-the-counter psoriasis product is based on the very well-known active ingredient salicylic acid, which is used since many years for the applications. I come to that later. But the difference to other products, to conventional products, is that we have added the Neopharm's so-called MLE, multi-lamellar emulsion technology, which gives a much stronger improvement for deteriorated skin barrier. This MLE technology is clinically proven to ensure the efficacy in atopic dermatitis and in psoriasis. I will show later some graphs about that. In addition to these two components, Neopharm has further developed a new active, it's called ADfence-P, skin protecting ingredient, which is based on PAR2 inhibitor, which has anti-inflammatory and skin barrier improving effects, but it is a cosmetic ingredient. What is psoriasis? I think everybody who is in the field in dermatology knows very well. It's a very severe illness. It can be, let's say, appear in your early years. Very often psoriasis starts with people who start with puberty, but then also you can see that with people in the 20s and 30s ages growing and developing even higher. Some people are lucky and have it only once in her life, but for many it becomes chronic, and these patients need permanent treatment, otherwise they have a very difficult life situation. Psoriasis also involves very much psychological stress, and people complain not only about the treatment of the disease, but also of psychological effects, and they have less confidence in their personality. So helping these patients and helping these people is very important, and I think everybody who's increasing their situation does something very well. That's what we're trying to do. What is the characteristics of psoriasis? Usually you find an impairment of the skin barrier function. It leads to inflammations, pruritus and scales, and very much you find the hyperproliferation of the skin, a very strong hyperdemesquation of the cell skins, and it's forming in thickening of the skin and scale formation. We also see that so-called immune cells infiltrate into the skin, so in other words, it now becomes clear that psoriasis is an immune disorder. What about the pathophysiology? The classical understanding was that the impaired barrier function of epidermis happens, and the way it was treated usually was with vitamin D and derivatives, antraline, methotrexate, retinoic acid and derivatives, and also arsenic. Nowadays, as we understand much better biological circumstances and feedback systems in our organs, we find that the immune system is very much affected in psoriasis, and now new ways of, let's say, treating this disease was developed. For example, one is a TNF alpha antagonist, Remicade, so much more, let's say, on the biochemistry and not only on, let's say, surface and causes. What becomes clear Psoriasis is genetically programmed. It's a dysregulated inflammation and triggered by additional environmental stimuli. Some people may have these genetic defects in their body, but they can survive the entire life without having the psoriasis disease. But others, let's say, who, for example, have a shock in her life because they lose some relatives, or even it can happen when ladies have their first pregnancy. This can be the cause when psoriasis starts to evolve. We are, as Neopharm, we are in the field of topical treatment, and what you can see in this table here are the, let's say, currently applied topical treatments. Very famous, of course, is light or UV therapy. The working mechanism is light is suppressing immune responses. Very efficiency. The advantage is very inexpensive and convenient for the patient, but it leads to photoaging of the skin. There's a risk of skin cancer, and it's also time-consuming. Classical other therapies are, let's say, coal tar. It's used in more than 100 years. These are derivatives of coals, but it was observed in the recent years that these can themselves provoke cancer, so they become much less and less important. Beside the disadvantages that coal is really also, let's say, dirtying all the clothes in the bed and underwear and other clothes. So it's not very easy to use, and the effects are not very nice. Topical retinoids are used quite well. They're very well distributed. However, there are side effects which you do not want to have. So more and more new treatments are developed. The recent ones in the past is vitamin D analogs. It also works in the way that there's some anti-proliferative effects. You use it for first or second line of therapy. It's quite well tolerated, but unfortunately it's not effective for all the patients. One very important example is calcipotriene. I think that's very well spread in these treatment of this psoriasis. And then last not least, a very classical treatment is salicylic acid. It has a very good exfoliating effect, mainly used together with some other agents, and it helps other drugs to penetrate easier into the skin. However, it's not so effective than other treatments, and we think this was a good starting point for the development of our new product. So why do we look into the psoriasis market? If you have a look at the world dermatological drugs market by market segment, you can see psoriasis market represents revenues of about $4.3 billion per year and represents 16% market share of all dermatology medicine applied worldwide. Next to this is let's say, treatments for dermatitis and acne, and then others. Now, our new OTC product based on salicylic acid is used, of course, again with this multilamellar emulsion technology. This leads to an improved skin barrier, and the effect of this, that the skin moisturization is much higher, and that we can avoid that any allergens can penetrate into the skin and lead to infections. And then next to the salicylic acid, we also added the ADfence-P, this new developed cosmetic ingredient with the PR2 inhibiting effects. So what's the relation between skin barrier function and psoriasis? Like in many chronic skin diseases, skin barrier abnormalities play an important role in psoriasis, such as triggering and or aggravating inflammatory systems. For example, if you look in the pathophysiology, skin barrier or disrupted skin barrier sustains the pathophysiology. In other words, if you can repair the skin barrier, it suppresses the further development of psoriasis. It also can trigger immune system. So like the old famous dermatologist Köbner from Germany found already in the 19th century, there's effects which triggers all in a sudden exploration and development of psoriasis based on this kind of effects. And then there are secondary or immune mechanisms like too much UV lights or X-irradiation, which also can start to develop and initiate some psoriasis effects. You might have heard about this so-called brick and mortar model in human skin. This model was developed about 40 years ago, and it's still today very famous and understood, and explains how the skin barrier, the stratum corneum, works together. So you can see the big gray areas are the corneocytes, the dead skin cells in the skin barrier. And in between these corneocytes you find the so-called intercorneocytes lipids, which have two effects. Firstly, they represent an antimicrobial barrier, so allergens cannot easily penetrate, they are kept outside. And also they are so-called an antioxidant barrier, and they keep the water in the skin, so they prevent drying. Drying is one of the very negative side effects in psoriasis, and repairing the skin barrier helps to reduce itching effects or other, let's say, unwished effects of the psoriasis. Here in this picture you can see a microscope picture from human skin cells. So the stratum corneum is here stained with ruthenium tetraoxide. That's why you can realize white and dark strings of the lamella zones. And in these lamella zones you have fatty acids, the ceramides, cholesterol. And basically what we are doing, what Neopharm produces, we make a mixture of these pseudoceramides, and we make a kind of a, let's say, artificial lipids with which we replace destroyed or dysfunctional skin barrier. We can rebuild it. This is basically the way how it works. So in dry and sensitive skin, the skin barrier is disrupted. Water can evaporate easily, that leads to this dry skin, but also any allergens can penetrate. And it's rather easily applied, so you just put the ointment or a cream on your hand and it very easily penetrates. And the nice thing is we quasi can rebuild in the same way like the human skin in this lamellar function, the skin barrier. On this chart you can see what is the effect of this MLE for the treatment of psoriasis. In 2005 already there were some clinical tests performed, and we could prove that the skin hydration was becoming better by using the MLA applied. So in this case it was observed that after 6 weeks of application of MLE on psoriasis patients, you can see the effects are going steadily downwards. And in the other testing what we are making in the following years, this was a proven and repeated effect. There were clinical tests made with Caucasian patients, so basically people living in America and European, coming from Europe. There were 25 psoriasis patients as volunteers accrued, and they were tested with our OTC product containing this 2% of salicylic acid and 0.1% of ADfence-P. And then this cream was applied on the lesional areas for more than once a day, so 2 times or 3 times per day. And then the target lesion psoriasis severity score was observed in 4 weekly rates in total of 12 weeks, so 3 months. And we can show you now the resolution of photographs of randomly selected 6 patients. And you can see here how well the effect is. So I have to say the psoriasis effect on these patients was not so harsh, mild to severe. This is the group where you use topical applications. And the baseline, the starting point was a TPLS ratio of close to 9. This was an arithmetic number of all the 25 patients. And you can see month by month how well the severity score went downwards. So as a total, as an arithmetic total, we have reduced the effects by 57%. So that's a very impressive number, and I think this is a very remarkable result which needs to be further discussed. We also accompanied these kind of observations by doing photo engineerings, and here you can see even here a visible scaling reduction of 82% was achieved. And then the third thing what we looked at was skin redness. In total, the reduction was 56% after the 3 months. What you can see on this chart are from left to right the treatment. This was the baseline pictures. So on the left side you see a left knee, on the right side you see a right knee of the patients, and you can see month by month how well not only the scale, which is underlaying here, the scales was reduced, but also the redness tremendously was reduced. So a very impressive effect, and the patients who participated, of course, would like to continue with this treatment. This is a next photo of another lesion, other patients. And then also here, so here you can see this is on the fingers, on the ankles. So that's typical for the psoriasis, where the skin is stressed. This is the main area where these diseases are developing. And if you look at the most right picture, is a fantastic reduction of the effects, and with a very promising result. We also, of course, checked the product safety. With our partner, the EMA laboratories in the US, we conducted the so-called RIP test. The result achieved with 25 volunteers was no primary irritant and non-primary sensitive to the skin. So very good results in accordance with the appraisal of the safety of the FDA from the United States. Now, as a summary for today, I would like to sum up. Psoriapalm is a non-greasy psoriasis lotion. It's an OTC product containing 2% of salicylic acid. It's based on our patented MLE emulsion technology, containing in addition this ADfence-P. Very good clinical efficacy evaluated in psoriasis patients, 72% improvement in scaling, 47% in erythema, 54% reduction in plaque evaluation, and overall 57-58% reduction in all the symptoms over 12 weeks. There were no side effects, and the people who were participating to the tests overall had a very good feeling and gave, let's say, their positive comments and would like to continue these tests. That was basically what I had to present to you. I hope it was of interest.